Sometimes we lament so much for lack of fun that unless we have enough fun, community life is no longer the same. There are loose ends everywhere in our community life. For a very long time, we have not taken the menace of drug and substance abuse seriously. Lately, we are beginning to realize that drug abuse, substance abuse is a disease. It is a sickness. And I think it is time that we address this issue from that perspective. Once upon a time, it was known as a social evil. And then we condemned those people. We punished them. We set them aside, away from the society. But we have come to realize that it has not helped. Therefore, I think as we analyze the problem, as we analyze the situation, and as we work toward making India and even our state a drug-free country and a drug-free state, we must address drug addiction as a sickness. I will say this as I conclude my challenge to those that are gathered here. We must strengthen our institutions. And when I say our institutions, we must strengthen our family. We must strengthen our village institutions, the authority. We must strengthen our church. The church should not just only be seen as a pulpit ministry, but the church, we must take the church to the streets. We must take the church to our workplaces. We must take the church to our homes.
Substance users continue to be criminalized, stigmatized, and further marginalized by our society, and many has been traumatized. As a result, substance users, especially those who inject drugs, are not coming forward to access health service means to protect themselves from HIV, viral hepatitis, and other infectious diseases. Without scientific evidence-based interventions, substance use related complications, social harm may progressively increase into a public health epidemic. The Union Home Minister Amit Shah, in his address in Lok Sabha Parliament, Winter Session 2022, he stated, "Be ruthless with the drug smugglers, but treat users as a victim." Again this year, in 2023, in the month of April, Union Home Minister told the anti-narcotic officials, "There has been a mistake on our approach till now. Our aim should be clear that one should consume drug users as a victim and smugglers as a criminal." Even our Prime Minister Narendra Modi, in his Man Ki Baat radio talk, he also said that drug addiction is a psychosocial medical problem. The American Medical Association has done a thorough research way back in 1956, and they have come to the conclusion that addiction is a disease. In 1958, WHO has endorsed and said this is a disease. Addiction is a disease. And I am very happy that our church the apex body NBCC also has acknowledged that addiction is a disease, so it needs to be treated.
On the 26th of June, since 1989, with the objective to strengthen action and cooperation to achieve a world free of drug abuse, with the support of individuals, communities, and various organizations all over the world, this day aims to raise awareness on the major problem that illicit drug represent today. Illicit drug represent to the society today. Many people who use drugs face stigma and discrimination, which can further harm their physical and mental health and prevent them from accessing the help they need. The United Nations Office on Drug and Crime, that is the UNODC, recognizes the importance of taking a people-centered approach to drug policies with a focus on human rights, compassion, and evidence-based practices. This year, with the theme People First, Stop Stigma and Discrimination, Strengthen Prevention, the campaign aims to raise awareness about the importance of treating substance abuse with respect and empathy, offering alternatives to punishment, prioritizing prevention, empowering young people and communities to prevent drug use and addiction, and combating discrimination and stigmatization against them and their families by promoting respectful and non-judgmental languages and attitudes. Unfortunately, our society is no exception when it comes to this serious social issue. The national level survey report published in 2019 shows that there are 6,24,000 substance users in Nagaland, of which 1,11,000 users are children and 26,000 users are female. And with the latest trend of substance users, the figures would likely have increased manyfold.
The problem with drug users is that they are not merely users, they are also traffickers or peddlers. It's a very close-knit network. A peddler is a consumer and a consumer is also a peddler. This is how it works. So if you want to try and penetrate into that circle to catch who is who, it's very difficult. So this is the major stumbling block that police and everybody faces, the law enforcement agencies face. I think even the health department and the social justice department will face this problem, because any one user or abuser who gets caught and if he is questioned, the others think that there is the risk of others being exposed, so they will not come out with this who is the abuser. Okay, I think we need to somehow work a method to break this nexus. I think winning over the trust and confidence of everybody is the point where we need to start. I think the most important issue there is what are the legal provisions. Now, the NDPS Act has been amended, which says that I'm just saying this because this can get carried out in the papers so that everybody knows how it impacts, what are the provisions. Now, if there is a user and a small-time consumer, there can be leniency for him as per law. Okay, he would probably have to be arrested, but on the assurance of the person or his family members that he will undergo rehab under the watch of either an NGO or a government agency or a hospital. There is no punishment to him. Okay, so my request is, if there is an abuser, please come and admit to us or to the NGOs or the Social Justice Department. Help yourself first. The abusers need to help themselves first. And when we question you from whom you are buying the drug, we are helping you to break that nexus of the sellers of the drugs, who are the criminals who are putting you into this entire vicious circle. I think you need to help this. One of the conditions for pardon or reprieve or whatever you call it, or a lenient treatment for an abuser or a drug user is that he has to tell the truth. Now, telling the truth is important because it helps you, and it also helps the user to break the bridge which has led you to a wrong lifestyle. So if you can share the information with us or with the NGOs about from where they have been buying or you have been buying the drug, it actually shows your keenness and your willingness to give up or give up the drug and get treated. So that has to be the point of beginning for all of you. All of you means the users. Madam Martha brought up the issue of moral policing. There are two aspects to moral policing. One is people beating up others or taking the law into their own hands. Now, I personally believe that a war against crime or a war against drugs is not only a police or a law enforcement effort, it is a collaborative effort between the society and the law enforcement agencies.
The high prevalence of narcotics and psychotropic substances in the state is a serious concern. As I said, we are making a lot of efforts, not only at the state level but even at the central level. As you all know, Nagaland is not a producer of drugs, but it is a transit point. A lot of drugs are coming maybe from Myanmar side and then from Manipur to Nagaland and then going into Assam and the rest of the country. And Nagaland is also a major consumption center. So we keep reading in the newspapers, many a time drug seizures are there. In Nagaland also, Manipur, Assam also. But are they making a serious impact? What fraction of the total drug trade are we able to catch? That is the question. We have been discussing with the Nagaland police also and various other agencies as to how best we can tackle this menace. My own understanding is that there may be small peddlers and there will be some kingpin, and I'm sure in every town or every locality there would be a kingpin. So my expectation is that we should be able to catch these kingpins, at least some of them, and take some exemplary action so that it sends out a signal that we are serious about it. Apart from the enforcement and the legal action, criminal action that we need to take, you see, equally important is the sensitization part. as was very rightly mentioned by the secretary, that a peddler is a criminal, a victim, the user is a victim, and as a victim we need to extend all help to him. Unfortunately, in our society perhaps it is still a big stigma.
Today we are united to take a pledge under the Nashamuk Bharat Abhiyan to make not only our community because change starts from within. So pledge together to make India drug free. I pledge that I will take all efforts in my capacity to make India drug free. Thank you so much. You may be seated.